aorta on the top. We've got coronary arteries crowning the heart and feeding it with blood. And if you have a heart attack, what can happen? Here's your artery. It's kind of a side view of it. If LDL starts to deposit there, it can bind with the triglycerides and start to form plaques. Because if LDL, which is your bad cholesterol, if the HDL doesn't come along and pick it up, it'll form plaques along with the triglycerides. So if a clot comes along, it can block this area off, or if you get some sort of inflammation in the arteries, that can close it off. So there's a couple different ways it can happen. And there's a protein called CRP, creatine reactive protein, and essentially the higher these levels are, the more inflammation you have in the arteries. So that's a test that you might want your doctor to test you. Even if you get your cholesterol checked to know that, you also need to know your CRP levels, because they can give you an indication of inflammation throughout the body. So anyway, so if this clot comes through, blocks it off, it's going to shut down blood flow behind it. And so what that can do is kill off a portion of this cardiac tissue. So if there's not enough blood flow here, that cardiac tissue will die and it won't repair itself, and essentially you have a heart attack there. So let's talk a little bit about different types of heart attacks. Most of them will happen fairly fast. I mean, not most of them. Some of them will happen fast. Most of them will happen slow. The fast ones, it's clear what's going on. They're having a heart attack. The slow ones, a little harder to determine. So they may have discomfort, and like around the chest area, but they could have discomfort in other areas of the body, like the arm, the jaw, the neck, you name it. Some people lower back. And what's happening is not enough oxygen is getting out to the tissue. And the same thing happens when you exercise. Sometimes when you exercise too much, you're not getting enough oxygen out to the tissue, and so acid builds up in the body. Lactic acid builds up. When there's not enough oxygen present, you can't get rid of the hydrogen, and the acid starts to build up. Same thing if you can't get rid of enough CO2 fast enough, carbonic acid will build up. That's how CO2 is stored in the blood, and your body becomes more acidic. So that would explain why you start to get discomfort. You can have shortness of breath, and that should make sense because you're not getting enough oxygen back to the heart. So you could get lightheaded, and that should make sense because you're not getting enough oxygen back to the brain because not enough is coming back to the heart. So all of those symptoms should make sense, especially if somebody gets nauseous and starts to vomit. Same thing happens in exercise. When your pH level in your blood drops below 7.2, your body becomes too acidic, and the fastest way for your body to get back to homeostasis is to cause you to vomit. Well, that happens during exercise. It also happens when there's a lack of oxygen and the body starts becoming too acidic. Your body wants to equalize that and get you back to normal and get your pH level back to 7.2, which is optimal. And the fastest way for it to do it is empty the stomach contents, because that's where a lot of acid is. So angina pectoris, that's what we were talking about when you may see some of the same symptoms that you see within a heart attack, because essentially angina pectoris is narrowing of the arteries, and so that's going to limit oxygen, but it's not completely blocked off. So the arteries, let's take out the clot here, so we're not having a clot, but it starts to get narrow, so not as much blood flow is getting through. And if your CRP levels go up, some people are sensitive to certain foods, and that causes their CRP levels to go up. It can cause inflammation in the arteries, and that can cause angina pectoralis, and which to some people may seem like they're about to have a heart attack, and they possibly could, especially if a clot comes along or it swells up too much and cuts off the blood supply completely. So the care, let's talk about the care real quick. You definitely want to call 911. It's a cardiac emergency. And we're talking back to heart attack right now. We want to call 911. This is care for a heart attack, just to be specific. So we want to call 911. We want to monitor their breathing. If they're unconscious, we want to begin CPR, or if an AED is present, we want to use an AED. Probably sitting is going to be the most comfortable position, because laying down kind of restricts their breathing somewhat. And then if you have an adult aspirin and they're not allergic to aspirin, 1 adult aspirin will do, or 2 chewables. But even with the adult aspirin, you'll probably want to break it up. You don't want them to get you don't want them to choke on it. So what the aspirin's going to do is thin their blood. So this should make sense. If we have a closed off artery, or just not enough blood's getting through, thinning the blood is going to make it easier to pass through. It won't be as viscous, it won't be as thick, so it's much easier to pass through. And if they're taking, you want to find out medications. And if they're taking some sort of nitroglycerin, you want them to take that, because what that's going to do is dilate the blood vessels. So again, back to this closed off area. If you have an artery that's being closed off to some extent, and you can make that artery larger by dilating it, then you can get more blood flow through. So that's what this does. That's what the nitroglycerin will do for them, is help get more blood flow. So now I'm going to move on. Got to move quick so I don't run out of time. So we have stroke. With stroke, it's essentially a heart attack for the brain. So let's just call it a brain attack. I'm going to draw my little brain. May look like a tree. Every time I draw it, to me, for some reason, it looks like a tree. So I'm drawing the cerebral cortex, the little folds in the brain where all your memories are. And then let me draw some, let me use red here. Okay, so now I'm going to draw the arteries going up into the brain. So this is the carotid artery in the neck feeding the brain here. Same thing applies. So let's take a larger snapshot of this. So this is our artery here. I'm blowing this up. So we have our blockage here, and we have a clot come through and block this off. So if that blockage occurs, let's say it's happening around here somewhere, then all this area will die. So that's a brain attack. And you have different types of strokes. Let me go back to my yellow. You have ischemic, and you have hemorrhagic. So ischemic, you've got the clot right here coming through, blocking it off, blocking the blood. Hemorrhagic, the vessel will balloon out and eventually rupture and bleed out in the brain or near the brain. And hemorrhagic, that would be a hemorrhagic stroke. So that's our brain attack. So how do we want to care for this? We want to think fast. So if this is how we're trying to determine what exactly is going on. So we want to look at their face. Is one side of their face, we try to get them to smile. If it looks like one side of their face is paralyzed, then that's a good indication. We want to get them to raise both arms. If they can't raise both arms, and again we have paralysis on one side, it's another indication. We also want speech. We want them to talk, and if they slur or or even don't make sense, that's another indication of stroke. A lot of times they may kind of get the words out, but it may not make sense, or they may slur their speech. And we want to note the time, because a lot of these treatments are time sensitive, and based on what time it happens depends on the treatment they're going to get. So that is stroke and kind of how to care for it, or at least diagnose it, I should say. That's probably better. Let's talk a little bit about asthma. This is going to be real quick because I am running out of time. So it's an inflammation of an airway. So it gets really inflamed and narrows. It tends to be chronic. Some people have exercise-induced asthma, and it only happens when they try to exercise. You're going to have some wheezing, coughing, chest tightness, shortness of breath. Hopefully they have an inhaler so they can open up that airway. So that is asthma. I know I didn't spend much time on it, but again, I don't want to run out of time. So we have seizure. This is going to be fast and furious. You're going to need more detail, I'm sure, so go to the PowerPoint or the book. The first thing is let them have the seizure. Don't try to hold them down or anything. They may do injury to themselves or you. Don't put anything in their mouth. Nothing in their mouth. They're not going to swallow their tongue, and you're probably just going to do more damage, or they'll choke on whatever you put in their mouth. So do not put anything in their mouth. Move things out of the way so they don't bump into them. And if it's over 2 minutes, you want to call 911, definitely. Get 911 on their way. If they wake up, ask them, have you ever had a seizure before? If they say no, they've never had one, call 911 because something's going on there. A lot of times individuals that have seizures will let you know if you're going to be around them any length of time, and they'll let you know if they want you to call 911 or not. But if it's over 2 minutes, definitely call. Or if they injure themselves, and try to give them some privacy. You know, if this is happening in a public place, try to give them some privacy as much as possible. They may have wet themselves, and they may be unwilling to give you information. They may even be confused, may not be able to give you a lot of information. So that's seizure. Let's talk about diabetes. This is a big one. I wish I could spend more time on it, and we will. Maybe I can make some other videos later on. So we have type 1. So this used to be juvenile diabetes. Essentially, you're not producing insulin anymore. You have to take insulin injections, or you may have an insulin pump. We have type 2, which is adult onset diabetes. This is where an individual has to watch what they eat. This is really becoming an epidemic in the U.S. Really important to understand this. That's why I want to spend more time on it later. Essentially, you're not producing the hormone insulin, and what insulin does for you. So here's our bloodstream. Insulin's going to allow the cells in your body to absorb glucose. So we have all this blood sugar. I shouldn't really have that cell out there. All this blood sugar floating around in the bloodstream. So let's talk about hypoglycemia. And then hyper. I'm just going to write these in here. So with hypo, your body is producing too much insulin. So there's way too much insulin. So your cells, let me draw a cell down here. Your cells are absorbing a lot of the glucose. So there's not a lot out in the bloodstream because all the insulin is making it easy for your body to absorb it. So in that case, you would give, this is how to care. Give them some readily absorbable sugar. Fructose is good. It gets in the bloodstream fast and clears fast. So fructose would be good. And give them something. And if they come back around, most likely it was hypo. Well, here's the dangerous one. Hyperglycemia. Let me scroll over. Hyperglycemia can lead to diabetic coma. And so what's happening here is there's not enough insulin. So there's just way too much glucose, which is sugar, out in the bloodstream. So way too much. And this can really hurt internal organs, and it can eventually lead to diabetic coma. So again, care is the same here. Well, I shouldn't say exactly the same. We still give them the same amount of sugar. And if it doesn't change fairly quickly, then we know their sugar's too high. We want to call 911. This is a scary, scary deal. Somebody can go into diabetic coma.